So, first question, what do you think about the relationship between occupational sciences and occupational therapy? How does occupational science supporting occupational therapy for you?
We'll start by talking about occupational science and the connection with occupational therapy in my experience. I think that occupation is a foundation for occupational therapy. This is basic knowledge for us to understand the occupational part of our name. And when occupational science started, I guess 30, maybe 40 years ago, we began to see that knowing about occupation gave us more knowledge and depth of understanding of daily life to bring to the practices of occupational therapy. So you have notes here about defining terms and occupation, human occupation, I think in the very simplest term is referring to what we do every day. But also not just what we do, but why, how, where, when. So there are questions in defining occupation, human occupation, that relate to time and place and forces in our context that determine what we do, limit what we do, give us opportunities. So all of this knowledge, I think, has helped to both deepen and also broaden our understanding of the kind of therapies that we might offer.
It's perfect.
You have a list of some terms around human occupation that I think are important. And so, for instance, I have been very interested with Dr. Anne Wilcock about occupational justice and occupational injustice. And in the simplest way, we began to ask questions. What are we going to talk about if people are deprived of occupation? So if we have people who have medical conditions and they cannot engage in some occupations, or if they are living in poverty and they are marginalized, so people on the streets and they are unable to participate in work occupations, so they're marginalized or alienated because they are in a workshop where they do things every day that are meaningless, and the imbalance that means that some people are so busy in what they do, and yet there are other people. Old people in nursing homes are a classic example, sitting with nothing to do. So it was in understanding what happens to people and their occupations that we began to give some terms to occupational justice, occupational deprivation, occupational marginalization, occupational alienation, occupational imbalance. So that's how I look at those terms. They are ways to describe what's happening in people's lives, and the terms immediately draw us to look at the context of their lives and the context of our practices to understand why they are deprived, why they are marginalized. So then we need to understand those political and geographical and social and other forces that determine possibilities for occupation.
It's okay.
Now let's think about the examples of how the knowledge of occupation that occupational science is bringing can be used in clinical practice. I'll use the example of working with older people. And you might be working with older people in an actual older person's residence or home, but maybe you are working with older people in their own homes. So we would go in with an occupational science lens, you might say, or an occupational lens, don't start by saying, oh, how are your hands or your range of motion, or can you stand and walk around? But instead we would go in and say, what are you doing every day? Let us look at the daily combination of occupations and your schedule and what choice do you have. So you have many older people who are caught in the nursing routine, for instance. So they have to get up at the same time as everybody because the nurses have to get the beds made, and they don't have a choice about getting dressed then. Maybe they don't have a choice that they would like to make their bed because the nurse says, oh, it has to be made this way. And then to eat something in the morning, do they have a choice of the kind of food that they might have enjoyed throughout their life? No, some of them are having to go to a dining room and they all eat the same thing, whether that's what they grew up with or not. So I think our occupational science and occupational lens allows us to ask what people are doing every day. How is it organized in terms of schedule? What choice do you have? Where can you do your occupations? Can you actually go out to visit somebody? If you are living in a care facility or even in your own home, do you have transportation? Or are you stuck until somebody says, oh, I will come and take you for a drive, but maybe you don't want to go for a drive that afternoon. So it's that knowledge of how important occupation is, and we should ask the questions about occupation. And is your life meaningful? Do you have something meaningful to do? So that would be how I would think about occupational science in working with older people who are very vulnerable to somebody caring for them and removing their choice, removing their opportunities, and standardizing how everybody has to live in a particular place. If I was thinking about applying it to children who are in school and have special needs, then I would bring my occupational perspective again to say, what are the occupations for those children at home? And, pardon me, and how are they able to fulfill a meaningful life at school?
It's okay. Yeah.
Most recently, my two projects are related to older people and children. One is a research project to listen to older women who live in a rural part of Canada to find out what helps them and what limits them from having a meaningful life. So we're not looking at, do you have to use a walker or do you have a chronic disease? Yes, many of them would have that. But the real question is, do you have a life that is still meaningful for you? And so we are collecting data as a research project using a method called photo voice. So you interview them, but they also give you a picture of something that is meaningful. So, one lady has a picture of her car because it's meaningful to be able to get out of her home. So that's one way of bringing occupational science thinking into research. The other one is with children and concern for social inclusion in primary schools. And actually that's a project that is taking me from Canada to rural Kenya. And actually have worked with an occupational therapist who is in the community, and she can help to go to the school, assess how many children have special needs, and then we are trying to think in the rural area with very few resources, how can we create a context for these children to have a meaningful occupation, meaningful occupations to learn and complete their education. So those are two examples of bringing occupational science into practice and research where although I might know, for instance, about children and I could, I guess, assess their cognitive abilities and so forth, my focus to start is on, can you participate in school? Are you included? What ways are you excluded? And then we think more about the environment, not so much about fixing them as individuals. Okay?
Thank you. It's okay.
Now we are talking about teaching occupation, and I suppose teaching and also learning occupation. And I want to give an example from my university, which is Dalhousie University in Halifax, Nova Scotia, on the east coast of Canada. And one example is that at this World Federation of Occupational Therapists Congress in South Africa, we have 16 students from our entry to practice class, which is at the master's level, 16 students and 5 faculty, and we have field trips, plus they are attending the conference, and we have debriefing sessions, reflective comments. We have WhatsApp all organized for that group, and they will go back and they will complete the assignments, and they will complete a course for credit by participating in this kind of world event. So that's one way to actually engage them in seeing how occupation is being used in occupational therapy through their field trips, but also through the papers that they are listening to. And in the university itself, there might be field trips where they analyze the occupations. They have some exercises to analyze their own occupations and to consider the occupations of certain populations, whether they're people with stroke and what happens to your occupations with stroke. So many exercises where they are challenged to think about occupations and to understand how occupational science is part of their knowledge base before they jump into thinking of a solution as a therapy. So occupation is that basic knowledge that gives us a particular way of looking at the world, looking at individuals, but looking at populations and groups. So are the homeless people getting opportunities for housing? So looking at that level, not just at one person at a time. So that's how we're trying to teach occupation. It's a more population focus, not so much individual. In other words, you hear me saying that I think occupational science is incredibly important for occupational therapy, and I wish you well in learning about it.